Hey everyone, and welcome back to the channel. Today we're talking about a vital organ that works tirelessly behind the scenes, your liver. But what happens when this powerhouse starts to struggle? We're diving deep into a serious condition called cirrhosis of the liver. You might think you know what causes it, but the full story is much more complex. Stick around, because understanding this could make a huge difference for you or someone you love. So what exactly is cirrhosis? Imagine your liver, which is normally soft and smooth, slowly being replaced by tough, bumpy scar tissue. This isn't something that happens overnight. It's the final stage of long-term chronic liver disease. This scarring is the result of persistent inflammation or hepatitis that damages healthy liver cells over many years. When too much scar tissue builds up, it physically blocks blood flow and prevents your liver from doing its critical jobs, like filtering toxins, processing nutrients, and making essential proteins. This can eventually lead to liver failure. It's important to understand that cirrhosis has stages. In the beginning, it's called compensated cirrhosis. At this point, your body is still making up for the damage, and you might not have any symptoms at all. Your liver is scarred, but it's still managing to function. However, as more scar tissue forms and liver function declines, it enters the decompensated stage. This is when symptoms start to become noticeable and more serious complications can arise. Now, how common is this? Cirrhosis is more prevalent than you might think and is a major reason for hospitalizations and deaths, particularly as people get older. In the United States alone, it affects about 1 in every 400 adults, and those numbers are on the rise, making it a global health concern that deserves our attention. One of the trickiest things about cirrhosis is that symptoms often don't show up until significant damage has already been done. Early on, the signs can be vague and easily dismissed. You might feel a little nauseous, lose your appetite, or just feel unusually tired and weak. Some people notice a dull pain in their upper right abdomen or see tiny, spider-like blood vessels on their skin. But as the disease progresses into the decompensated stage, the symptoms become much more distinct. You might develop jaundice, which is a yellowing of your skin and the whites of your eyes. Your urine might turn dark, like cola, while your poop becomes pale. Itchy skin without any visible rash is also common. Some people notice small yellow fatty deposits on their eyelids or unexplained weight loss, especially muscle loss. Swelling in your legs and a bloated abdomen from fluid buildup, a condition called ascites, are also hallmark signs of advanced liver disease. You might also find that you bruise or bleed much more easily. So, what's causing all this damage? When people hear cirrhosis, many immediately think of alcohol, and it's true that long-term heavy alcohol use is a leading cause. But it is far from the only one. In fact, non-alcoholic causes are incredibly common. A major one is something called metabolic dysfunction-associated steatohepatitis, or MASH. This is basically damage from having too much fat stored in your liver, often linked to conditions like high cholesterol, high blood sugar, and high blood pressure. Chronic viral infections are another big contributor. Hepatitis C, for example, is a virus that often becomes a chronic, long-term infection. The good news is that it's now curable with antiviral medications, but the problem is that many people don't even know they have it. The same goes for chronic hepatitis B. While there's a vaccine to prevent it, if the infection becomes chronic, it requires lifelong management. There are also less common causes. Autoimmune diseases, where your body's own immune system mistakenly attacks your liver, can lead to cirrhosis. Certain genetic disorders can cause toxic substances to build up in the liver. Even long-term exposure to some medications, including common painkillers or environmental toxins, can cause chronic damage. Lastly, certain heart conditions that affect blood flow to and from the liver can also contribute over time. Because this is a serious condition, it comes with a range of complications. As your liver's function declines, you can experience a general feeling of toxicity, making you feel foggy and ill. Your immune system weakens, and you might have trouble with digestion and absorbing nutrients, leading to malnutrition. One of the most dangerous complications is something called portal hypertension. This is high blood pressure in the vein that supplies blood to the liver. This pressure can cause fragile, swollen veins, called varices, to form in your esophagus and stomach, which can rupture and cause life-threatening internal bleeding. Other severe complications can include kidney failure, respiratory failure, and an increased risk of developing liver cancer. If your doctor suspects cirrhosis, they'll start with a physical exam and a detailed medical history. Then come the tests. Blood tests, specifically liver function tests, can reveal signs of liver stress and damage. Imaging tests like an ultrasound or a special type of scan called elastography can show the liver's size, texture, and measure its stiffness, which indicates the level of scarring. In some cases, a liver biopsy might be needed. This is a minor procedure where a tiny piece of liver tissue is removed and examined under a microscope to confirm the diagnosis and help pinpoint the cause. This leads us to the crucial question: can cirrhosis be cured or reversed? The short answer is no. The scarring itself is permanent. Unlike some other tissues, once the liver is this heavily scarred, it can't regenerate back to its original state. However, and this is a very important however, treatment can often slow or even stop the progression of the disease. The goal is to halt the damage in its tracks. Treatment is all about addressing the underlying cause. If it's a viral infection like Hepatitis C, antiviral drugs can cure the infection and stop the inflammation. For autoimmune conditions, medications can help manage the immune response. If alcohol is the cause, stopping drinking is the single most important step. This often requires support and treatment for alcohol use disorder. For fatty liver disease, the focus is on managing metabolic factors through diet, exercise, and sometimes medication to control cholesterol and blood sugar. Regardless of the cause, lifestyle changes are essential. This means completely avoiding alcohol and any non-essential drugs that are hard on the liver. A healthy diet and maintaining a healthy weight are recommended for everyone with liver disease to reduce stress on the organ. Doctors will also treat the complications. This might involve procedures to stop bleeding veins, draining fluid from the abdomen, or managing other organ systems that are affected. In the most severe cases, when the liver is failing and other treatments aren't working, a liver transplant becomes the only option. A transplant can be a life-saving procedure, but it involves getting on a national waiting list and meeting specific criteria. So what's the outlook? It really varies. Someone with compensated cirrhosis who manages the underlying cause might live for many years without major issues. The prognosis is generally better if the disease is caught before major complications like portal hypertension develop. Once the disease is decompensated, the average life expectancy does decrease. But remember, these are just averages. Your individual health, the cause of your cirrhosis, and how you respond to treatment all play a massive role. The best defense is prevention and early detection. Getting routine health checkups can catch early signs of liver trouble before it progresses to cirrhosis. If you have risk factors like heavy alcohol use, metabolic syndrome, or a family history of liver disease, talk to your doctor. Vaccinations can prevent hepatitis B, and if you know you have a chronic liver condition, proactive treatment is key. Cirrhosis is a serious diagnosis, but it's not always a final verdict. By understanding the causes, recognizing the symptoms, and working closely with your healthcare team, you can take control and aim for the best possible outcome. Thank you so much for watching. I hope this information was helpful and empowering. If you found value in this video, please give it a thumbs up and consider subscribing for more health content. Stay safe and take care of yourselves.